Welcome everyone to the webinar put on by BlocPower and Green and Healthy Homes Initiative on the intersection of electrification and health. And we'll be looking at findings from a study that we jointly did together and talk about kind of the implications. Obviously there's a lot of energy and new investment being made in electrification. So we think that this connection with electrification and public health is very critical as these investments are being undertaken. So we've got two panelists today from BlocPower. Clare Doyle Dowd, she's a director of policy, and then my boss, Ruth Ann Norton, who's the president and CEO of the Green and Healthy Homes Initiative. We're going to start off just top line agenda. They're going to go into their companies and organizations, give you some background of their relevant work. Then we're going to kind of talk about some of the top line items from the study. And then I'm going to moderate some questions around sort of what does this study mean for stakeholders around the country, and then also take questions from the audience. So as we go through, please feel free to put in the questions into the questions and answers in chat, and we'll take questions after the presentation. So I'll kick it off. I'll pass it over to Clare.
Hi, everyone. Thank you for joining us this afternoon. Appreciate your time and sharing an hour of valuable time during the day to learn about our exciting work with the Green and Healthy Homes Initiative. My name, as Mike mentioned, is Clare Doyle Dowd. I am the head of policy at BlocPower, and I spearhead our policy research funding initiatives and also our government and enterprise partnership engagement work at BlocPower. We work with key leaders in the building decarbonization and healthy homes arena, like including partners like GHHI. So a little bit about BlocPower. BlocPower is a Black-owned, Black-led climate technology company founded in 2014 in Brooklyn, New York. We have a focus to deliver greener, healthier, smarter buildings to all, and to reduce greenhouse gas emissions in implementing these solutions. Many benefits accrue to residents in multifamily buildings that we focus on. And we also see a lot of the benefits of our work in job creation through the implementation and execution of this work and executing building decarbonization in multifamily buildings. This is what we call the building decarbonization ecosystem. BlocPower focuses on making communities smarter, greener, and healthier for all. And we achieve this through our core strategic mission through three pathways. The first is the building decarbonization and planning and execution work that we do around the country. The second pathway is by making buildings smarter and greener. And we do this through building improvements, including building envelope improvements, mold remediation, air sealing, installing air source heat pumps, and other electrification measures. We also have a focus on a green workforce program, and this is a key part of enabling our mission. It is to create and advance green collar jobs in the HVAC industry, energy efficiency, solar and electric vehicle charging are some of the areas that we focus on. BlocPower works with partners to raise funding for workforce development programs and implement these programs to provide benefits to new job creation and a workforce ecosystem across the country. BlocPower is working in communities across the country to deliver the building decarbonization workforce and building software solutions that we have invested a decade of experience in. Over this time, some of the impact of our work can be measured by the number of buildings impacted, the number of families that benefit from these improvements to their homes, and the numbers of jobs that are created. More specifically, BlocPower has worked in more than 1,000 buildings across the country, completed more than 1,000 measures in these buildings, including solar installation, air source heat pumps, air sealing improvements, and many other measures that improve the quality of these buildings and the quality of indoor air quality and health for families residing there. And more than 4,500 families have benefited from these building improvements across the country. The impact of climate change and the imperative to deliver solutions for our planet and our communities is high stakes. Partnerships are the key way to develop and implement solutions. And BlocPower works with cities like San Jose, the city of Denver, the city of Ithaca, New York, Cambridge, Massachusetts, to help design and implement building decarbonization solutions, workforce solutions, and technologies such as our BlockMaps software to achieve many of these objectives. BlocPower partners with a broad range of enterprises, including utilities, national labs like ORNL and NREL, and state energy offices like NYSERDA and the Massachusetts Clean Energy Center. We partner with community-based organizations and national nonprofits like GHHI, who are national leaders in the nexus of health and building decarbonization. These are essential partners that we work with to achieve our mission and the mission that will improve our planet. I'd like to turn this back over to Michael and to Ruth Ann.
Yes, and thank you, Michael, and thank you, Claire, for the just courageous work of BlocPower really going out and really having a vision of electrification for the United States that has its own awesomeness that is helping to inspire and lead others. I want to thank our team, Michael and Wim Tucker, Kevin Chan, and others who worked on, Brenda Brown worked on in our paper integrating health-related services and into electrification upgrades and the feasibility study that we did around the electrification work like BlocPower does. And I'll talk a lot about that. But a little bit about Baltimore. We are headquartered in Baltimore, Maryland, and work throughout the country. And today, especially we here in Baltimore, send our thoughts to those who lost their lives in the collapse of the Key Bridge, an important and tragic event, unfortunately, that happened here today. But GHHI was founded over 31 years ago as an environmental justice and racial justice organization. Today, as we have grown nationally, we focus our work at looking at the social determinants of health, opportunity, and racial equity in our approach, which is a whole house approach, which I'm going to really talk about a good deal. And how do we build healthier housing and through housing remediation, repair, and retrofitting? And how do we use climate dollars as restorative justice as we improve the health and stability of housing in what has been our most historically disinvested, disenfranchised, and often overlooked communities? So we have a high bar of the work that we want to help be a part of and help lead in this nation as we look at electrification as an important part of our elements of healthy housing. So some of what you will see in our work and out of GHHI is our direct service work, where we are endeavoring to create whole home, not only demonstration projects, but a way of doing business by aligning, braiding, and coordinating resources and both economic and human resources. We also do a lot of policy work, and some of that is helping to lead innovation and market transformation to focus on health and focus on what it means to add equity, not only in the process, but in the outcomes for years beyond. So some of the important things that we are working on are building electrification standards, zero emission appliance and heating standards, and helping to chart pathways in the states in which we work to be grounded in health and in the opportunity of the whole house approach. So let's talk a little bit more about that. So our premise of how we align, braid, and coordinate resources so that we can make it less frictional and less fractionalized for families and deliver an integrated whole house approach is especially important as we are seeing new federal funding come down, the soon to be announced greenhouse gas emission dollars, the thriving communities work coming out of EPA, but the ongoing funding around weatherization, around lead hazard control, asthma reduction, home repair, and really bringing together the critical mass of that work together, and also including our utility assistance programs. And we're demonstrating that across the country. We are, and others, of how we will drive this work, and that will be incorporating the rebates, the electrification tax credits as well. So in our Detroit home repair program, we're aligning with utility funding from DTE and philanthropic funding led by the Gilbert Family Foundation to establish a comprehensive approach, assessment, and utilizing opportunity to build the capacity of many CDOs, nonprofit organizations. In Pennsylvania, they have passed a law around the whole house approach, and we've supported that work and supported the work of entities like Built to Last, PEA, and the good work that's being done to take a holistic whole house approach. Certainly in our work with the Board of Public Utilities out of New Jersey is really groundbreaking to have a utility board really supporting this alignment between weatherization, decarbonization, electrification, and health, where we're using funding from the Department of Community, DCA in New Jersey, health dollars, and the weatherization electrification dollars coming from the state to create a better future, better outcomes. Milwaukee's doing this work as well, aligning their ecosystem, their area, and their lead together to create a whole house model. And then we are demonstrating that as a way of doing business in our sites, in addition to Trenton, but led by our work in Baltimore as our flagship program, but also in Providence, Memphis, and other places around the country. And the work we're doing in Baltimore is aligning those IRA dollars, congressional dollars, statutory dollars that are coming, as well as state, local philanthropic dollars and investment from healthcare. So we'll talk a bit about that as we advance electrification and decarbonization at the heart of this, because it is better for the health, stability, and value that we can bring families by this approach. So what we looked at in our study, one if not the first study to really look at how do you integrate health-related services into electrification, not only for to be used in this instance that we've looked at, but how people can plan the electrification of buildings upgrades, residential upgrades, and what's the pathway even of healthcare investment of electrification and decarbonization in its role in advancing and addressing the social determinants of health. So I really encourage you to read it. But in this report, we built a model that can help others quantify the health impacts of residential electrification by the stark improvements of indoor air quality and lowering particulate counts, and being able to improve that and related respiratory impacts. We've also estimated the value of those health savings from residential electrification due to nitrous oxide, reduced mortality in asthma-related hospitalizations and emergency department visits, and also that the outlying benefits of improved quality of life, better sleep, and that come from that as well. The report really looks at that whole home operating model We've laid out a potential model for Alameda County on how braiding electrification retrofits with healthy housing services can lead to better health, economic, and social outcomes for residents. And we've also looked particularly at California's very innovative Medicaid policies for funding asthma home repairs, which is a potential payment mechanism for electrification if stove replacement is included as an approved measure. So really important in California today, using an in lieu of part of the Medicaid standard, doctors can actually write a script for their asthmatic patients that has money that can include moderate home repair and remediation measures. And we're looking at how do we open that pathway more to be inclusive of a decarbonized, electrified home. So as you look at the model, we're looking at health benefits of improved indoor air quality from electrification. You can see from these charts just the really important benefit. The value of the indoor air quality for health-related benefits for what we looked at in looking at the BlocPower work in Alameda is estimated to be $268,735 or $520 per housing unit. That is actually a really significant improvement in the scheme of the market. And the majority of the benefits come from avoided hospitalizations, emergency room visits, mortality factors, right? And around those hospital and emergency room measures. But it's looking at nitric oxide mortality related mortality rates is the most significant. The asthma ER visits, the hospitalization visits, and also the impact of carbon monoxide on myocardial function. We are looking further in other ways that we are looking at the health data on an ongoing basis to also what is neurological benefits and other things that I think will come in future studies and future health benefits that you'll see around electrification as we lower these carbon emissions in housing. So as we're looking at this population, right, with at least one asthma-related hospitalization, which we looked at, and we look at the present value of those benefits, you can see the really significant savings here on this chart that are looking at nitric oxide-related asthma hospitalizations and as well as the mortality and ER visits, compared to an electrification initiative targeting general population, a program that focuses right on patients has a significant yield of more than a $1+ million in value from the avoided hospitalizations. And this is significant, certainly for quality of life, but something that Medicaid programs, healthcare programs need to pay attention to. And serving those populations that have with asthma has significant equity benefits. If you look at the racial and demographic data on the rates of asthma in the Black and Brown communities, our low-income communities. In Oakland, for example, over 50% of asthma-related emergency department visits from children under 5 are African-American children, despite being only 20% of the population. And this is something that we see not only in Oakland, but almost in every jurisdiction around the country. So we have an opportunity to really change the arc, right, and close those racial disparities and move to an equity framework here that kids can get in the classroom healthier, better and better ready to learn, because asthma is the #1 reason that keeps kids out of school. It's also estimated to be the #1 reason that parents miss work in relation to their children's illnesses related to asthma. So this becomes a significant economic engine. Certainly health benefits return, but a driver of long-term social determinants of health, opportunity, and equity. So as we looked at our analysis here, and as we're building this framework, we also built out what a whole house and whole home program can look like, leading with electrification and aligning this with asthma reduction and asthma trigger reduction, health and safety remediation while in the home. We really strongly urge programs to look at all of those health aspects, including lead, including mold, mildew, and moisture, and the significant infrastructure repair, while we are looking at improving the electrical grading in the housing and removing those carbon emitting appliances. Utilizing weatherization dollars is critical in this work. Bringing in electrification dollars, alignment with solar, and what also will be very critical in this is the alignment with rebates and tax credits as we move that forward. So we've laid out examples here and in every community where we're doing this asset gap analysis and health analysis work, what is available right in the community, whether it's dollars from Med-Cal, whether it's lead and healthy homes dollars, weatherization dollars, EBCE health, e-health dollars, and those incentives for electrification upgrades, the rebates, and also utilizing what's in the marketplace for other grants like the climate pollution reduction grants, the EPA community change grants, as well as the healthy housing and other HUD dollars to be in alignment here, and be able to build a really strong referral process in here through Breathe California and asthma assessment scope of work, looking at that up front and really knowing that electrification readiness, moving that over to other programs, the Asthma Smart programs, the Spectrum programs, looking at entities like Revalue. You can see what's on the slide here. But if we have this alignment in any community, the power quotient, no pun intended, on quality of life is actually real and visible. And we're seeing that in our work in Baltimore, where we are taking this whole house approach. And I think, Mike, we're going to get to some of that in the questions. So let's move to that dialogue.
Thank you, Ruth Ann and Claire. And for the attendees, as a reminder, if you've got questions, you can put them into the chat now. I think we're already seeing some questions come in. I've got a few just to kind of start. Claire, for you, and as Ruth Ann shared, we're talking about unprecedented numbers of dollars coming down from the Inflation Reduction Act and other related kind of programs. And how do you see that amount of funding sort of supporting this connection between electrification and health?
Yeah, sure. And thank you, Ruth Ann, for your presentation and the work that you and Mike and Wynn and many others at GHHI have led in the incredible report that you developed and are presenting today. To answer your question, Mike, I just to reiterate a little bit of what Ruth Ann mentioned, the Greenhouse Gas Reduction Fund, $27 billion, I believe, is going to be announced within the next 1 to 2 weeks, and it will have a tremendous impact across the country. The NCIF, the National Clean Investment Fund, which will have $14 billion of funds, will impact not just cities, but rural areas as well, where there are resilience concerns with flooding events and things like that. So the Greenhouse Gas Reduction Fund with the NCIF will disperse funds across a wide network of local partners. So these would include CDFIs, nonprofit organizations, green banks, that will be working in these communities. What are some of the improvements that will be made for these homes? Well, it will be exactly what we've mentioned before, improvements to multifamily housing with improvements to building envelope measures, the implementation of air source heat pumps, which has an impact, a positive impact on the health of low-income residents in multifamily buildings, and other measures. So these funds will be deployed over a 7-year period and will have a tremendous impact in every region of the country. The other area that will have an impact also are the home energy rebates that Ruth Ann mentioned before. These are the home and HERE rebates. These rebates will go to state energy offices and will be dispersed in every state in the country that accepts and develops, I should say, a state energy office plan to the DOE. These are performance-based rebates, at least for the homes program, and will have a big impact on multifamily buildings where the types of measures that will improve the health and well-being of residents include weatherization types of measures, and also air source heat pumps will be eligible to be implemented, air sealing. So your question is, what's the nexus of healthcare and this federal funding? It's not just that the funds will be dispersed, it's that there is a rich ecosystem of partners that understand on the ground, like GHHI and others, what are the needs in the community and how to effectively deploy those resources to address a myriad of issues that can help the health and well-being of residents. I'm not sure if you, Mike, or Ruth Ann want to add any comments to that.
Mike, I'm happy to jump in here. And I think, Claire, as I was thinking about what you were saying, I think the one thing people really that we are focused on, and I want leaders and community organizations, right, as we work to also build capacity of the entire ecosystem, is this is a absolutely once in a lifetime opportunity to not walk away from places that this country has walked away from, to be able to go in our most historically disinvested, underutilized, overlooked communities, and be able to go into housing and in alignment not only with the greenhouse gas emission dollars, but all of the other dollars that are coming because of the infrastructure and bipartisan infrastructure act and IRA and the rebates, the ability to drive capital investment that will help us close the appraisal gap, the 8-to-1 appraisal gap for African American communities to white communities on intergenerational wealth transfer of real estate, but to really drive the opportunity for health. This may be an opportunity greater than any other on what we've been able to do on lead removal, lead-based paint removal, which still remains 84% of the reason the kids get poisoned by lead is from the paint in their homes. By going in and taking out old, obsolete appliances, replace them with next generation electrified appliances like heat pumps and electric or induction stoves, all of that is great for the environment. It is great for the value of housing and so great for health. And so taking this whole house approach that we're taking in Baltimore, we're able to not only employ in communities, but help to create ownership of those contractor jobs. We're not only able to improve an individual house, but improve and revitalize the climate resiliency of communities, and being able to take a very bold vision to the practical courage of common sense and put that into play. So whether it's, what we're doing in Trenton in working out from a Board of Public Utilities to the community, to state policy, to practices, or what we're doing from ground up, literally in Baltimore, or where in Alameda County, there's just this rich ecosystem of resources to work together. I think that every community listening to this or doing this, right, should also be talking with their healthcare providers, their state Medicaid offices, about the benefits and about the reinvestment opportunities. But by taking the whole house approach, we will ensure that we can electrify, that we can weatherize and electrify houses that, prior and still today in many places around the country, families get deferred or decline because of the mold, the mildew, the moisture, the lead paint, the broken stair treads. Now we have the opportunity to address that, and we have to address it to improve the electrical systems and electrify houses. And we strengthen roofs as we put on solar. We have the opportunity to do all of these things together. What a unique opportunity we have. And the data is showing us and leading us to do this when we center it on so many reasons, right? But clearly centered on health and economic return.
And as a follow-up, how do we get to that scale that we're talking about? We're talking about thousands, tens of thousands of housing units and things like that. And how can stakeholders think about it at that level?
Claire, I'm happy to jump in together on this one. One is we have a massive opportunity, agenda, and need to really scale workforce in community and in the communities we're working in, every community. And I would say this is going to be especially challenging and important in rural communities for sure. But we are talking about a scale of job electricians, a scale for plumbers, a scale for skilled contractors, right? But also those doing data assessment, working with an informed data collection with community, transparent evaluation of the work. There is enormous job opportunities and an enormous need to build up from the ground on capacity building on that. So I think that's one in front of us. I'll let Claire pipe in here, but the workforce. And then the other is really a coordination on how we're going to coordinate and make sure rebates and tax credits are converted to cashable savings for families of all levels of need, and being able to present a more unified, a more aligned, a more coordinated approach, because it's a lot of money driving. So we want to deliver that in the most effective, efficient way so that we're not exhausting families and others in buildings as we move that into communities across America. But Claire, I'm interested in your take.
Yeah, I just want to double click on, the workforce element, Ruth Ann, because that, excuse me, that element has been mentioned in every single conversation that I've had across the country with state energy offices, with utilities, with community partners, and the desire to not only have a workforce that is transitioning from technologies that will maybe not be invested in so much to new technologies is one area, but also in folks who are underemployed, low skilled. That is part of the focus of BlocPower's work. And there is a very strong system or ecosystem and opportunity to partner with community colleges, for example. That is part of BlocPower's work. So connecting community colleges with job training opportunities, and perhaps, looking at some of the healthcare connections with the healthcare ecosystem with community colleges is another area. BlocPower has, it's not only that the need is there, but again, going back to this partnership idea, that is the partnerships in workforce systems, workforce partners is how BlocPower works. And so one example of that, Ruth Ann, is in Houston. BlocPower is actually partnering with Goodwill of America, which is one of the nation's largest job training entities. And we have an air source heat pump lab in Houston, Texas, that we have implemented over the last several months with some new cohorts that are working every day on these workforce training opportunities with air source heat pumps. But where does that connect back to, the healthcare and the job training? It's that, there are new technologies around sensors that are with another partner that BlocPower has worked with called Acclima, who's done outdoor air pollution sensor work and employed some of our workforce training members in New York State and in other areas. So looking for continuous partnerships in the execution of workforce programs and opportunities is really, will make a big transformational difference in the country.
Yeah, absolutely. And we want those heat pump labs in Baltimore and Trenton. We visited one in Philadelphia that PEA has an ECA. But also, Mike and Claire, the Solutions Project is doing amazing work on Justice 40 accelerators and contractor accelerators with groups like Elevate and others around the country. And there are so many good examples growing. We'd love to get people in contact with all of them, but I just want to give a shout out to the great work that Glory's doing at Solution Project to move much of this forward as well, and places like Elevate that are working in Illinois. And I mentioned also, as we think about how to do these things, right? And we'll come back to it, but there's a lot of opportunities through other federal funds to bolster the need to build that capacity to get much better paying jobs in this work. So I think there's big challenges, but with big challenges are incredible opportunities for this country.
Mike, if I can just jump in on another point around scale. I think community engagement is another area with partnering with community-based organizations that will be, that develop, these solutions and look to develop partnerships at the local level, and scale related to kind of identifying clearly the co-benefits of energy efficiency and decarbonization and health and housing, and have that type of model be developed and understood at the community-based level. So identifying environmental benefits of decarbonization related to health, which include reduced energy demand and reduced greenhouse gas emissions, identifying very clearly for community understanding and engagement around the housing benefits of this work, including improved quality of housing. As Ruth Ann also mentioned, the improvements of these buildings also should accrue the benefits of an improved appraisal of this housing as well, improved indoor air quality, increased housing stability, and also resident benefits, especially with a focus on elderly and children. These are some of the important groups that really benefit from these investments in these buildings. And so how does this connect to scale? Well, identifying and understanding this model and communicating that across community benefit or community-based organizations is really important.
Thanks, Claire. And we've got some questions from the audience, so I want kind of go through. I think the first for you, Claire, question around like the retrofits and you know, is BlocPower using any of the building certification programs that are being used in the U.S. in terms of sort of like the standard, you know, for the electrification retrofit?
Yeah, I mean, we have BlocPower has an engineering team at which is one of our we have several departments at our company. We have 95 employees. We have an engineering department, product and technology department. But to answer that question, we our engineers look at buildings and use all of the you know, the building electrification, you know, the standards in the industry as part of our energy assessment of buildings, and the solutions that we identify for the building owner. So that is part of our regular practice of what our engineering department does.
Great. Thanks, Claire. And question maybe, Ruth Ann, if you want to start, what can folks in the energy efficiency space do to engage healthcare in a productive way? How do they talk to the hospitals, their health departments?
Well, I think right. There are some tremendous studies around carbon emissions and housing, and great work coming out of Stanford, great work coming out of Hopkins and Nadia Hensel there. But I think if you are looking at an issue like asthma, you can't avoid the impact that carbon emissions have on respiratory disease. And more recently, I think it was the New England Journal of Medicine, but one of the medical journals came out about the particulate reduction if you're using heat pumps, right, versus traditional heating sources, on lowering that particulate, right, is going to have that value. But our healthcare systems are, through the ACA and by where we have moved in the past decade, really looking and supposed to be looking upstream and looking at social determinants of health. So by improving health, improving housing stability, which we know from our own work, right, Mike, and the families that we're serving, we are seeing that improve. We're seeing grandparents being able to have their grandkids over for the first time because the kids are not going to be at risk. But I think that get to the meetings around community assessment and community needs that every hospital system does. They're often run by local health departments. Look at the outcomes that are set out for Medicaid, set out for the Children's Health Insurance Program, and programs like the CHIP programs that invest in lead and healthy housing and asthma, right, and asthma reduction like we have in Maryland. You can't do better than investing in these programs to really think about respiratory disease. But you have to go in with both facts, right? You have to go in with case studies. You have to go in with opportunities. For the healthcare system, it has to both have that health evidence merit, and it has to have that return on investment. We know in our programs in Baltimore, where we have healthcare investment, we are returning significant dollars back in per patient per month savings, in more than $1.58 for every dollar invested back in our work. So these are important ways to craft the conversation. I would say to anybody on the phone who's interested in crafting a conversation with healthcare, we're happy to be thought partners with them to do that. But if we think to the future and what we know, the climate crisis itself is a healthcare crisis and is a public health crisis. 40% of all carbon emissions are coming from housing and buildings. And we can address that and be a part of that solution with healthcare. So I think we will see a great deal of rapid change on how healthcare invests in climate through healthier housing work. But I'll let Claire pipe in here too.
Yeah, I agree with everything you mentioned, Ruth Ann. One of the other things that I would mention is that um, having looking at some types of technology, including sensors, that really will deliver the types of metrics and the data that is convincing to a healthcare system, I think is very important. Sensor technology can be part of a building electrification solution. BlocPower is actually doing that we have a program in Denver called the Denver Healthy Homes Program. And that is also partnering with an ecosystem of health partners in that community and health systems. And the sensor technology can identify the benefits of indoor air quality before the building electrification solution, and then afterwards, and aggregating that data, I think is very compelling for healthcare systems, which have to tie changes in their program back to these types of metrics.
100%.
Next question is around corporations and how can they be kind of part of promoting electrification and environmental health equity? Are there some near-term opportunities for corporations to be involved as well?
Well, we'll start with the corporation first and come back to the nonprofit to answer that.
Yeah,
That's you,
okay.
Claire.
Yeah, I know. So, yeah, I mean, I think the corporate sector is, obviously, very large. It's hard to kind of describe, what that means. If it's a corporate sector that's related to, for example, a REIT or a portfolio owner of multifamily housing across the country, I think, the way to engage that type of partner is through, engagement of the nexus of building electrification and health benefits that accrue to the residents. If it's a different type of corporate partner, connecting to the ESG, is really an important area that is of concern and an area of focus for all corporations. So an investment in a solution around a pilot or a solution of a remedy in a city or an area that a corporation that is maybe headquartered there could be like a very interesting way of engagement. There are a number of corporations that have very robust foundations that invest in these types of solutions and community-based partnerships every day. And these foundations are also, look to leverage private sector dollars as a way of investing in these solutions. Ruth Ann mentioned a few minutes ago the importance of the Greenhouse Gas Reduction Fund as a tool to leverage private sector investment. And, I think looking at corporations and the corporate investment just as a way of amplifying what some would call grant funding from the government is really something that is very attractive and has, a multiplier effect. That's kind of a general perspective about, corporations, but if it's around healthcare insurers, for example, there are many healthcare insurers that are interested in social determinants of health. I think of Kaiser Permanente has had tremendous investment in social determinants of health on the West Coast, in looking at food as a prescription and other remedies. So, Ruth Ann,
I can't. Well, first of all, we have to remember that there are people who work at corporations of all kinds, right? And corporations should be very concerned and invested in where people live, where they spend time. I think there's ample opportunities in both the private sector on healthcare and the corporate sector to be able to think about the well-being of communities. I think about Lancaster General Health and the commitment they made to put $50 million in to de-lead the homes in Lancaster County, and now adding in healthy housing work and hopefully potentially some of this work around that will be spurred on by the HERO Act and the rebates and the electrification. But there are corporate philanthropy, banks, and others are really critically interested in workforce development. It is such an important area here, and really building pathways to workforce. But I think as we all look at the really shared benefit of social determinants of health, there's going to be an awful lot of need, right, to do the research and the evaluation work of we're going to be looking at true cost savings for families. We have in Baltimore, through our DOE awarded Buildings Up program, a community-based electrification advisory board to help socialize and know the facts about electrification, to think about in any community cultural barriers of getting off of gas to electrification, and to think about the continued innovative solutions that we're going to need to give people confidence in that. Corporate philanthropy and corporations, both on the innovation and the funding side, have immense opportunities here. And we're going to need, Michael, a lot more of this analysis and reports. And so we got to fire up the crew on that as well.
Yeah, thanks. And I apologize. We're not going to get to every question, but please, we will reach out after the webinar. So please reach out, and we'll be getting back to folks. And as we kind of wrap up the hour, if you all could kind of share, your final thoughts. What are the next steps that we're going to go with this connection? Maybe Claire, if you can start.
Yep, sure. I mean, I think Ruth Ann actually teed it up beautifully a moment ago. I think, a few things. Number one, partnerships like this are incredibly valuable, and will develop, research, engagement, and other solutions. The other final thought that I have is that, continuously reiterating and repeating the messaging around building electrification and health benefits and the benefits of reducing greenhouse gas emissions in messaging, so that resonates with the American public. There are apparently in recent polling, the benefits that accrue to healthy community or to communities related to health investments and the energy transition is a message that resonates with the American public, and along with other messages around job creation and making communities stronger, which is what Ruth Ann mentioned before. So repetition around kind of the messages of building electrification and health improvements, I think really is important.
Yeah, I think the more that we are constant and consistent in facts, in walking this path with communities together, and really investing in ways that people not only can feel it in their pocketbooks and can see the changes, but feel it in their health, is incredibly important. We're going to need healthcare to step up. We're certainly going to need a lot of other opportunities to have more community-driven advisory boards, to share data in ways that people can believe it, see it, experience it. There's no doubt we have to move to a better and more climate resilient future, and it really does start at home. So I think we will continue to build that base of fact, of life experience, and of opportunity with communities. There's so much to learn, so many good projects around the country. And I will encourage everyone to know what's happening in their state's climate pollution reduction grant to add to this opportunity, to engage in those opportunities that exist in the grant opportunities from the federal government while we have this window of opportunity out there. And to share your thoughts with us. I'm sure BlocPower would say this as well. We are learning and advancing together. I want to again thank my team and the BlocPower team for working on this report. You know, we've set some seminal studies in this country that have really motivated a lot of change. I think this will do that as well. Thank you, Mike, for being a terrific moderator. Just the brilliance of your good work as well. And cheers to everyone, and thank you for the opportunity today.
Thank you both. Thanks everyone for attending.
Thank you, Mike. Thanks, Ruth Ann.